or acquired immunodeficiency syndrome, is a disease which afflicts several million people all over the world. Currently, more than 33.5 million people are living with AIDS or its causative agent HIV, and 25 million have died from AIDS since reporting began in 1981. AIDS is caused by HIV, human immunodeficiency virus. HIV, though only recognized in the early 1980s, began infecting humans as early as 1910. The virus actually has its origins in SIV, or simian immunodeficiency virus, which affects many Old World and African primates. HIV spread when a chimpanzee infected with SIV came in contact with a Central West African hunter, where it then mutated and was able to infect humans. The virus spread silently through Central Africa until the 1980s, when an infected individual carried it to modern-day Kinshasa. At this point, Kinshasa was undergoing rampant urbanization and a population boom, which allowed HIV to spread to the rest of Africa, then Asia, and from Haiti on to other Western nations. Virtually every country in the world now has citizens affected by HIV/AIDS. Now Lucy is going to give us a personal look at the AIDS epidemic.
Today, our guest Megan Foreman of Philadelphia will discuss her life after she became HIV positive through a blood transfusion. Megan, it is a pleasure to have you here today.
Thank you for inviting me. I hope my story is able to help others understand HIV and AIDS more clearly.
What led you to believe that you might be HIV positive originally?
I started feeling sluggish and fatigued with flu-like symptoms. One day after a blood test, I discovered I had HIV.
Could you please explain to our audience what HIV is, how it affects the body, and what is the difference between HIV and AIDS?
HIV is a retrovirus found in specific human body fluids. HIV is transmitted through sexual contact, pregnancy, childbirth, breastfeeding, injection drug use, occupational exposure, and blood transfusion or organ transplant. HIV works by directly targeting CD4 protein on the body's Th1 T cells, dendritic cells, and macrophages. HIV then binds to either the CCR5 or CXCR4 co-receptor of CD4 proteins and uses the HIV GP120 envelope protein to bind to the cellular membrane, causing the release of GP41 protein. This release allows the virus as the envelope to fuse with the host cell membrane and release the viral RNA into the cell. Once inside, this RNA is reverse transcribed into dsDNA and integrated into the cell's DNA to become a provirus with the help of viral protein integrase. The provirus begins synthesizing proteins called TAT, which amplifies the strength of transcription, and REV, which facilitates the transport of RNA to the cytoplasm. This allows for the proteins GAG, POL, and M to be made, which leads to the construction of viral components. Once this has been done, the new virus bud out and kill the cell. The T cells of the immune system respond to the HIV infection, but become exhausted and destroy eventually by apoptosis. AIDS is the disease in which so many T cells have been killed by HIV that there are fewer than 200 CD4 T cells per cubic millimeter, which is significantly lower than the normal minimum of 500 CD4 T cells per cubic millimeter. I had HIV, but due to my low CD4 count, I now have AIDS.
What sort of symptoms did you experience?
I felt perfectly normal for several years, as HIV can have a latency period of 2 to 15 years. Unfortunately, I started to have very low energy, and at first I thought it was just the flu, but then I had fever, body aches, and a sore throat, which was also misdiagnosed as the flu, but a blood test later confirmed that I had developed AIDS after contracting HIV years before. Having AIDS, I suffered year-round infections from opportunistic pathogens, which are normally cleared by healthy people.
What kinds of medications and treatments are available to patients suffering from HIV or AIDS?
Medications are divided into 5 different categories. Nucleoside-nucleotide reverse transcriptase inhibitors work by blocking HIV's integrase enzyme from inserting newly reverse transcribed viral DNA into the cell's DNA. Non-nucleotide-nucleoside reverse transcriptase inhibitors prevent reverse transcriptase from functioning by inhibiting the movement of the enzyme. Protease inhibitors work by stopping protease enzymes that are necessary for viral polypeptides to become functional proteins. Entry and fusion inhibitors work by blocking HIV's ability to attach CD4 T cells in the first place. Integrase inhibitors work by blocking the function of HIV's integrase enzyme to incorporate the provirus into the cell's DNA. Patients are treated with a combination of these drugs in order to maximize the treatment program.
Megan, thank you so much. Hopefully a cure will be found in the future. In fact, right now, research is being done to mutate human hematopoietic stem cells and block CCR5 expression to prevent HIV from entering T cells.